This presentation is being recorded and will be sent to members via your restaurant login on our website, and the slide deck will be available at the same time. If you're not a member, you know, I mean, for this kind of an emergency, we're going to make this just available to everyone. But usually our webinars are in person, and then if you're not a member, basically it's you get an email from me and we'll talk about membership. We've got a lot of people registering right now, so I'm going to go a little slow on this. You all know me. My name is Carol Wight. I'm the CEO of the New Mexico Restaurant Association. I've been here for over 17 years, and before that, I was in restaurants for 20 years. So I certainly know what you're going through. It breaks my heart, what we're all going through, and we're doing our best here to support you. We also have on Antonia Roybal-Mack. Antonia is the founder and managing partner of Roybal-Mack Cordova. She's a powerhouse. She's going to be talking to us today about federal and state relief efforts and how to contact the folks that you need to contact during this time. We also have Henrique Valdovinos. He's been in the hotel and restaurant industry for 40 years. He has extensive experience on both sides of front and the back of the house. And he is also one of our ServSafe instructors. And those of you who have taken our Spanish class have definitely met Henrique. He is our Spanish ServSafe instructor. And with him, we have Donna Hebert. Donna is has been in the nursing field for almost 20 years. She was inducted into the National Honor Society of Nursing and graduated with honors. She has completed her second graduate degree in as a family nurse practitioner, and she's going to talk to us a little bit about the health issues and what we're really facing here. So without further ado, I'm going to have Antonia start, and I don't have slides from most of these folks.
Carol, can you share your screen with me?
Or I can stop my share and you can share your screen with me.
Okay.
See you, bud.
Okay. So I've stopped my share.
Okay.
What's that anti-aging thing?
NAD.
Yeah.
All
so
right.
she's getting NAD plus, and so
sorry.
yeah, like I said, so that's something that we have. That's our newest offering on our menu. So it's not technically on the menu yet.
So I want to go ahead and talk about some things that you can do right now. A couple things are, you know, talking about how can your company help? How can you add more value at this point? You know, one thing we talked about this morning is people are not broke, they're just bored. And kind of what's this new reality that we're going to live in?
You know, Antonia, one moment, please.
Yes.
We've got some background noise. Could we get people? Dion, can you mute?
Is that better there?
That's better. Okay.
Okay. Yeah. So, you know, talking about this, I think right now, you know, the way we're looking at it is innovation definitely wins the game. We've seen lots of, you know, breweries doing things, paleta bars, going out and kind of bringing back the old style ice cream truck. But I want to really talk about what's available and some ideas that you can use right now. One is to create some different revenue forecasts. We started, when I created this 2 days ago, I was looking at a 15% revenue drop. Go down and look at what a 30% revenue drop does and what a 50% revenue drop does. Look at your cash on hand and how long can you keep the employees that you have with the cash on hand available to you. And what are your supply chains going to be doing in the next, you know, 30, 60, 90 days? And I've seen restaurants in rural New Mexico repackage their inventory because they don't have grocery stores there. So there's lots of ways that innovation is going to help right now. And I don't think any of that is off the table from a regulatory standpoint. So I think it's not just about, we're not going to slow down, but we need to think about how do we reallocate the resources available to businesses right now. You know, one thing that we're looking at, what people want is clarity, they want certainty, and they want simplicity. And I think the restaurants, the businesses that can adapt to these three things right now are going to really be the ones that come out of this ahead of the game. So, you know, typically whenever the government would say, we're here to help, what can we do for you? Most of us business owners would quite frankly laugh, because it's unheard of the government stepping up. You know, I think right now they're doing so in a big way to the best of their capacity. So what I want to go through are just the programs available. So the first thing is, if the whole goal would be to not lay off your employees. I realize that's pretty inevitable with some of the things that are going on right now. Department of Workforce Solutions, if you cut your employees' hours, they can qualify for unemployment benefits up to the $467 per week. If you do a full reduction in force, those employees will also qualify for unemployment benefits. There's no work search requirement right now for those that are unemployment, so that's going to be helpful for your employees to make sure that they continue to receive those benefits. And then you want to look at your financial forecast. Look at your financial forecast that I just talked about, you know, the 15, 30, 50% revenue drop, to figure out when is it that you might have to look at these reductions in forces or looking to cut employees' hours. If you have any group disability policies, you want to look at it and say, okay, what will it cover? It will certainly cover if an employee gets sick because of COVID-19, but it might also cover employees who are suffering from mental distress as a result of this. Where can you get other working capital? Just this morning, New Mexico was approved for the Small Business Association loan program, the disaster relief program. What these disaster relief programs do, this particular program is for borrowers who would not otherwise qualify for a traditional loan. So if you don't have sufficient credit to get a good business loan, this is the program for you. You can apply online. It is a loan. So when you go to apply, you need to have your list of assets, list of debts, EIN number, number of employees, and have some set amount that you're going to be seeking for your inventory loss or your economic injury. So those are the two things under this disaster program that really apply to restaurants right now. I went through the loan. Yes, ma'am.
Can I ask you, will they have to pay these loans back?
These are loans, yes, ma'am.
Yeah.
You do have to pay them back. The SBA loans, what's so advantageous is that if you're not otherwise credit worthy, you still qualify for these loans.
Okay.
New Mexico also, and the site is sba.gov/disaster. Then if you go through, New Mexico also has a...
Antonia,
Yes.
wait just a second. Can you get the people that are behind you to stop talking?
Yeah, let me ask them. Yeah, I'm sorry about that.
It's just, everybody's getting the reverb from that.
You got it.
So they'll do.
Let me see.
I'm not sure if there's a door.
I'm trying to figure that out. Yeah, I'm sorry about that. What it is there's kids running around, so that's kind of what are you?
Because everybody's at home.
Yeah.
Yeah.
Give me just a second. I'm sorry.
Okay, if you don't mind. Thanks. Folks, we'll be right back. We're trying to get some of that background noise to go away. Apologies for the delay.
Carol, we do have a first question too, if you want to grab that while she's adjusting.
We've heard about possible grants that would not require repayment. Is that something you've heard about and recommend waiting for and using as opposed to the SBA loan? I have heard that they're going to pass something at the federal government that will allow states to get block grants. It's just not going to happen in time for what's happening to our industry right now. If you have 2 weeks to wait. I think it will be passed within the next 2 weeks, but I don't know when that money is finally going to end up in New Mexico and available to folks. Antonia might know more. Here, Antonia's back on. Let me get her unmuted. Okay, there you go.
All right, sorry about that. So let me go through the New Mexico loans that are available. You go to gonm.biz. This is on the New Mexico Department of Economic Development sites. And if you email jbrooks@nmfa.net, you'll be able to find out a list of partner banks. Because they're so inundated with emails right now, I would actually recommend go to your local bank, go to wherever you bank anyway. Go to wherever you bank anyway and see if they're going to be a partner bank to this program. This is a loan guarantee program. So what it means is that the bank does not have as much risk giving you a loan if you're not showing strong cash flow or the other things banks want to see, because 80% of the loan is guaranteed by the state government up to $50,000. So this is another way to get working capital loans. The LIDA loans, that's the other one available to the state. Those are likely going to be available. They are available to those in rural areas. Most restaurants, Bernalillo, Santa Fe, Las Cruces, are not going to qualify under the LIDA program. Let's talk about, you asked about other grants that are going to be available. Right now, if there's any nonprofits, Albuquerque Community Foundation is doing a $300 to $5,000 working capital grant. That's a grant that nonprofits do not have to pay back. There's the Bartender Emergency Assistance Program. I've put the link on there, and this is also grants to bartenders affected by COVID-19. And then there's a program, another grant called CORE Gives. This is children of restaurant employees. That's what CORE stands for. They also have a grant program. That's the Bartender Emergency Program is already up. CORE Gives, I understand, will be up by the end of the day. And then you have various lenders that are offering, Apple Pay, different things that are saying, we're not going to charge interest for the month of March. I think they'll extend that out to the month of April. But right now, I don't have any information. I know that the federal government is trying to pass a relief package, but I don't know when it's going to pass and how soon that money is going to get into small business hands. There's $50 billion available, is what I understand, through the SBA right now, and that's going to be their main way to get this information out. So you're going to want to check. I've checked the SBA website every day. And just this morning, New Mexico is considered as a disaster zone, but continue to check back there because there's new resources that come up every day. I can certainly stand for any questions that you have.
So we had one while you were gone, and it was about the possible grants that would not require repayment. And I answered it with the same thing you said, is that we just don't know right now. The feds will come up with something, but that money is going to come to the state, and the state is going to divvy it up as they see fit, not necessarily as it's needed. So I wouldn't rely on that.
Correct. I think the best bet is to look at the SBA loans are going to be a really good option, as well as the state loans. The only issue I see with the state loans is the $50,000 cap. If this goes into April, May, that might not be enough working capital for people to continue to pay landlords and so forth.
Yeah, one of the things I did ask the governor's office is to give us at least a thought of a date certain when this would be over. And I know she can't do that, but it's going to be very hard for folks in our industry, looking at a almost complete shutdown of your business. How long do they have to wait? How much should they borrow, et cetera? And then how can they pay that back on the other end if they couldn't afford it in the first place? So I know you can't answer those questions, but those are some of the questions that are coming up for our members. If you would share screen back or take your share off.
I'll stop sharing and then it's all yours. And then I'll mute myself here.
So are we back? Can you guys see my screen? All right, so I'm going to unmute Henrique. Henrique, we talked for a little bit, but can you talk a little bit about what's happening and what you're thinking?
Well, Henrique Valdovinos, I'm the Director for Dietary Services here at Lovelace Women's Hospital. And being in the healthcare side, you know, we obviously are being very aggressively informed in regards to everything that is happening. And there is a lot of misinformation out there, especially if you're tying down everything that you hear to the news. So there is literally for us, you know, 3 basic websites that people can literally tap into and see what's going on. The first one is the CDC website. The other one is the World Health Organization. And the other one is the U.S. Health Organization too, right?
Yeah, and then also it's nmdoh.org. It's New Mexico Department of Health. They update more frequently than the CDC does, unfortunately. So the New Mexico Department of Health will give you updated information probably every day. CDC's like every other day or 3 times a week is what's been happening.
This is Donna Hebert.
Hi.
He's our infection control nurse, and that's why, you know, I asked her to come. So I'm sure there's going to be some questions in regards to what the virus is doing. So the reason, you know, that I'm really wanted to participate on this, first of all, I've been in the restaurant business forever. It's my industry. And sometimes I think that I feel that we get to be a little lackadaisical about how we approach certain things. This is something that we're dealing right now with that is very serious, and it's here to stay. You know, we're looking at things, and there's all the time new stuff that is coming up about the virus. How is it spreading? You know, the effects that it's having in people. You know, the death tolls. There's a lot of comparisons that has been made with the flu, you know, they're similar, but they're very different. The difference between one and the other is that this virus spreads very rapidly. You know, the amount of time that it takes for this virus to really develop is about 2 to 14 days. So that is very much the windows that we as restaurateurs, we need to be working with. And I'm talking about the way we approach our staff, our guests, and now, you know, with the governor taking these measurements, I mean, follow them in a way that are going to be literally effective for us, because it might hurt a little bit right now, but later on, we're going to literally, I think, be better if we follow these guidelines and not resist not following them. I think one of the things that is going to happen in our industry is that we're going to become a lot more creative in the way we do business. Our industry, we have some amazing restaurants in the city and through the state, and I know that there's inventories that are being holding on in the walk-ins and in the dry storages, and there is a staff that they don't know what's going to happen from one day to another. And I think creativity at this point in time is going to make a big difference. I want to tell you just a couple of things in regards to what this virus is doing. We know for a fact that this virus stays in metal for at least 30 minutes. So if you go to a supermarket and you're online with somebody and then they happen to be infected, but they have no symptoms, remember there's 2 to 14 days window for them to be able to literally have any symptomatic expressions in their body, right? So if that person touches metal, there is a virus right there. You pass by and you just touch it, and then after that you touch your face. Guess what? Now the virus is beginning to develop in your face, right? You might not get symptomatic right away, but it's going to have an effect on you. So the one thing that I have seen through all this stage, you know, let me take one step back. Clothing about 12 minutes. And there is some new statistics that came out that are talking about hours for the virus to really start decaying from full strength to half strength to 0 strength. So the point of all this is this: Serve Safe. Everything that is being preached on today is in our Serve Safe books. Serve Safe is literally, in a way, without everybody saying it, it's the hand washing time that people are requiring is in Serve Safe. It's 20 seconds. Some of the stuff, don't touch your face when you're dealing with food. It's in Serve Safe. So all these measurements that have been popping up is not something that is strange and foreign to us. The point of this is, just as we do Serve Safe, a lot of people in our industry, again, They go, they learn it, and then they take it for granted and don't apply it. This is the time that our rules and regulations really, we need to be very firm and convinced that of the incredible power that they have for us to be able to overcome this issue that we're living as a nation. Don't take it for granted again. Make sure that you are overcautious at the beginning of this. It's better to be that way right now than later on to regret it. The to-go part of our industry, I think, is going to develop huge because we're still living in a city where people love to go out to eat. And that is going to be something that I think we can encourage people to do by staying in their cars and we're providing food for them and just figuring out a way to make sure that we can get it to them through our staff and maintain most of our staff employed, right? That's the point, that we might see a big decline in regards to the workforce, but I think the point of all this goes back to my original point. Let's be creative. Let's make sure that within the creativity that we're going to utilize, we apply every one of the rules and regulations that we have learned and measurements of caution that we have learned through ServeSafe. There is one thing that is happening at the national level that ServeSafe is offering, and it's just refreshing courses in regards to hand washing, in regards to, you know, approach of uniforms, cleaning, safety and sanitation. All those things are being covered within our ServeSafe website. So I am sure that here in the organization, in our restaurant association, you know, there's been some things that we're going to be able to make available to you, you know, and I'm sure that will be discussed more later on with Carol and the staff. But again, my point is, be focused, use the tools that you already have, and be very well prepared. Now, I'm going to let Donna talk a lot more about in detail in regards to some of the issues that I just described.
So I'm not going to get into a lot of statistics because it's on the CDC and it's on the Mexico Department of Health, and it changes so rapidly. What I do want to emphasize is this is a novel coronavirus. We already have a human coronavirus, which is part of the flu panel, which is part of our respiratory panel. So our body can fight that because it's human. This, just like SARS and MERS and swine flu and bird flu, came from an animal. So therefore, the RNA makeup of this virus, our bodies cannot fight it. We have no antibodies whatsoever. So that's the scary part. And that's why it's different, because the virus itself can get into your respiratory system and then drop down into your lungs. And with a matter of 2 to 14 days, you can become very, very sick. Now, on the flip side of it, young children, babies, and middle-aged without any comorbidities, and comorbidities is anybody who doesn't have asthma, COPD, emphysema, they're not they don't have cancer, HIV, anything like that. Our bodies are strong enough to fight it on our own. However, our older population, now they're saying 65 and up, typically have a lot of comorbidities, typically have lung issues. You know, their lungs, you know, like anybody in the ages, our lungs wear out. Those are the individuals that are dying. The problem too is, just like anything else, we're in a flu season. We're right in the middle of flu season. We're right in the middle of allergies. So I'm kind of want to go over the signs and symptoms of the COVID-19 or the coronavirus. So it, like Henrique said, it could be in your sinuses, in your face, for 2 to 14 days before you get that fever, before you get that cough, before you get the malaise, before you get all that other kind of stuff. It is indicative that if you have been in close contact, meaning you live with somebody, or you roommate with somebody, or your children go to daycare with somebody, and they have presented positive with a confirmed diagnosis of the COVID-19, that you tell somebody, your employees. Do not allow anybody, because of fear, to come back into their establishments and work because they're afraid of losing their job or whatever, because it's, like I said, they may not have a fever, they may not be coughing, they may not have those horrible symptoms just yet, but the virus is still shedding. It's in that dormant stage, basically, but it's still shedding as we speak. Now they're finding out that eyes is the biggest way that this virus gets into you. So like Henrique said, you touch something, you touch your face, you touch something, you wipe your eyes. You know, allergies, everybody has itchy eyes these days because every tree in Albuquerque is blooming. Be very, very diligent about washing your hands. wash your hands for 20 seconds. And that doesn't mean just run them underwater. It means scrubbing in between your fingers. It means scrubbing those fingernails. It means using your thumbs and really getting those thumbs. You can use hand sanitizer, but the same thing applies to hand sanitizer. You can't just put a couple drops of hand sanitizer on, go like this and call it a day. It has to be worked in and it has to dry before you go elsewhere. Cross-contamination is huge. I know a lot of us like to wear gloves, like to put gloves on, but if you're not changing those gloves and washing your hands, you're just setting yourself up for failure. You know, touching the computer screen with the gloves on, touching the money with the gloves on, touching the stainless steel, touching whatever, and then touching your face, you've just opened up a whole world of issues for yourself. The biggest thing, like I said again, I'm gonna stress hardcore on hand washing. You have got to wash your hands. You have got to wipe down countertops, surfaces, everything more than what we've done before. It has to. Get rid of the open food areas, which I'm sure a lot of you have. And mind you, I'm a nurse. I love to cook, but I'm not good at it. And I don't work in the restaurant industry. But those open areas where anybody can walk through, have potential for talking over. You know, we have droplets that come out of our mouth when we speak, happen to walk by and sneeze on something and not mean to, or cough on something and not mean to. If we eliminate the possibility for that to even be a cross-contamination or a cross aspect of getting this virus, get rid of them. I know the governor has said a lot of stuff and we're going to see a lot of closures and 50% less and all that stuff. But even with that, and my heart breaks for all of us because it's going to be pretty significant for probably the next 2 weeks, if not the next 3 weeks. We are about 10 days behind Italy, and Italy is getting hit hard right now. So we need to be prepared for it, but we also need to be diligent about what we can do to stop the spread, stay out of public areas, stay away from like concerts, stay away from big groups of people. If you feel sick, tell somebody. Have your employees, be sure that you have an open dialogue with your employees and your staff, your management, or whatever, that there's no ramifications that are going to come about if they're sick. Because I'd rather have somebody tell somebody than work for a week and then all of a sudden the whole entire place has to close down and everybody has to be quarantined. Quarantine is 2 weeks. It has to be 2 weeks because like I said, or like Henrique said, 2 to 14 days, you can shed the virus without showing symptoms. And within those 2 to 14 days, you might show symptoms. The testing, not everybody is going to be tested. Not everybody is going to need to be tested. The test kits that came out, we went through a whole lot of them this weekend, are all around Albuquerque, and that's fine because it's a learning process, it's a learning curve every day. So just know for your employees, the best thing to do is go home for a 14-day quarantine. Stay away from everybody. That doesn't mean, I just now was told that I'm very, very sick. I'm going to go to Walmart. I'm going to go fill up my gas tank. I'm going to go pick up some dog food. I might go get a couple tops at Target, and then I'm going to go home for 2 weeks. That means you take your happy little self into your car, drive home, and you stay in the house for 14 days.
Yeah.
No, you're good. The only thing that I wanted to add is that, you know, we're actually adding a screening thing for our staff. For our entire staff here, we're screening. We've asked 4 questions. When that screening is, have you been out of the country in the past month, 3 months, 6 months? We ask if they have had any symptoms. We ask if, what is the third question that we ask?
If they traveled outside of Albuquerque, outside of New Mexico, because a lot of the states are becoming hotspots as well. If you've traveled internationally, or if you've been in close contact with somebody that has a confirmed coronavirus positive test,
which
is beginning to happen right here in our city. So
I think that's really a great best practice is as your employees show up to work, if we're able to do this takeout and do it creatively, and I've got some ideas coming up, but if we're able to do that, it's a really good best practice. Make your employees think about what's happening. Have you traveled? If you have, you know, we love you, but we're going to have to send you home and you're going to have to get unemployment at this point. You know, there's things that we have to do to make sure that we're keeping, I mean, think about it. So you have an employee who is infected, and now everybody that came in contact with that food is infected. It is not a foodborne illness, but they're touching the utensils and plates and things as they're going in this, and so that picks up, and like you said, it sticks around on metal for how long? 4 hours?
30 minutes.
30
In the middle,
minutes. And
but
plastic.
there was something today that says that it can be there at up to 6 hours, you know, before it starts decaying to full strength, from full strength. So,
Okay, so I want to move on because I do think people are fairly aware. I really appreciated that, Donna. I think that was, you know, that was what we needed to hear, because there is a reason for this happening.
Carol, may I add one thing?
Yeah.
You know, we have a couple of thousand restaurants here in the city, and there is only about maybe 30 people in here. You know, so the one thing that I want to say is thank you, first of all, for being here. I get it that you guys are here to make sure that you know, how is our business going to survive. I get that. I think the most important part for us right now, as part of this industry, is to make sure that this message gets passed to others, because that will also help us in regards to the to how our businesses and our industry will survive through this major crisis we're going to go through. And again, you know, I just want to thank everybody that is participating today, and hopefully pass that message to others anytime, any chance you have, any way you can.
Absolutely. So there are things you want to consider, and this is, you know, we have until tomorrow to decide some major things in our life. And so now, honestly, I put this webinar together yesterday and it's already outdated, but I think there's some really good things in here. Does your restaurant have a revenue model for takeout only? And does that meet your expenses? This is some of what Antonia was talking about, but I think it's something you really need to sit down with your partners and discuss. Is it worth staying open with a negative revenue model? Now think about that. If you're at to-go only and you've got employees that you're paying, you need to figure out how long you can do that in the red. Consider the options of taking on additional debt. So in a lot of cases, you know, you really shouldn't take on additional debt right now, because you've got to pay it back, even if it's just eventually. It's going to be very difficult to pay it back. So a lot of people are deciding to close for the meantime. I've got to say, some people are deciding to close permanently. That breaks my heart again. Some things you can do is have discussions with your landlords and your bankers. You should, we're going to ask for the state and or the feds to stop all landlords from being able to kick you out. So we'll be doing some of that, and we think that's going to happen. Ask them to reduce your rent. Ask them, you know, if you can. I mean, they're not going to get anybody else in your building, so ask them to give you some relief, and you know, work with them as best you can. The other thing, I think the utility companies are saying that they are not going to stop utilities if there's non-payment, but be sure and talk with them. Make sure that they know that that's a situation, and ensure that they keep the gas and power on. I think what they're saying right now is that they're not going to shut anybody off. If you're going to shut down, here's some procedures that you need to take. And we've got this on our website. I would say, Henrique mentioned some other websites that you want to look at, but don't forget, this is our website, coronavirus front and center, and we've got a resource.
Hey, Carol, I'm sorry to interrupt you, but we can't see your screen.
Oh, you can't. Oh, Antonia? Oh, never mind. I think it's me. Thank you, guys. So this is our website. And you can see right here, we've got the resource page, and we are updating it as things come through. So there's some other resources down here that I think are really going to help you, as well as we have a resource that's going to allow you to, if you don't already do takeout and delivery, here's a resource for you that you can figure out how to do that. What's the best hygiene? How do you do offsite delivery? How do you do takeout? So I just wanted you to see our website is where you should be right now. Every day you should go to our website and see what's the latest. We are borrowing stuff from states across the country that are going through the same thing. But again, back to the closing procedure. Cancel any scheduled deliveries. Close out your month-end procedures. So alert your payroll company. Have your employee contact information and address updated. Alert your health insurance company to the layoffs and the elimination of benefits. Set up a restaurant email to be forwarded. Set up a restaurant phone to be forwarded. Cancel reservations, which shouldn't be a problem now. Take a final inventory of all food and beverage and prepare to transfer perishable food. You can donate it. And I just want to say that we're going to go through some things here that will give you a little bit more hope than how to close your restaurant. But I just want you to be thinking about those things. There's more to it than just closing your restaurant. It has to do with, you know, all this whole list. And just for a full list that includes bar closure, we have it on our website, and it is on that web page. For your staff, for unemployment, send them to jobs.state.nm.us, or you can give them this 800 number, 877-664-6984. And, you know, the Secretary of Workforce Development, we've been in contact with him. They are waiving work search requirements, and somebody can get unemployment as quickly as within 2 weeks. So once they apply, they wouldn't get it that first week, but they would get it that second week. And honestly, I mean, if you have people that you're laying off, please get them there soon, because this is going to be, I don't think they'll be able to keep up. I don't think they understand that our industry is 96,000 strong and that we're going to be laying off half of those people with this edict from the governor. One thing we're asking the governor is, we've had conversations about keeping our unemployment rates the same. It's really going to hurt all industries if our unemployment rates go up. That is some of the relief that we're asking for. Haven't heard anything back about that. The workforce secretary has said that they would need to call a special session for that. So it looks like we may be asking for a special session quickly. And remember, we are the spear of we are the tip of the spear in this. We are the ones who are going through this first. The hotel industry started losing business. Now we have lost business to a degree, or will be losing business to a degree that's going to really deplete that unemployment store. So get out there fast. So I have been talking or hearing about creative ideas that they're doing in some states. You know, don't limit your takeout to just the meals that you serve. Think about how to serve and sell raw food, cook at home food, cooked food, in bulk curbside. Think trays of lasagna, trays of tacos, and then the other side of that is if you have a supply of toilet paper, you know, you can probably make some money on that. I would say it's very imperative that we don't overcharge for things, that we don't look like we're trying to take advantage of people. Our message to the government right now is that the grocery stores can't handle this. We are 50% of the food sales in this country, and we need to keep our doors open, at least to takeout and delivery. The other thing that you need to start thinking about is delivery and how you can do that. You need to talk to your insurance company. We have talked to our work comp company, which is Food Industry Self-Insurance Fund. They don't usually insure businesses that do delivery, but they will insure for work comp. They will insure our industry for that right now. So keep that in mind, but do talk to your liability insurance prior to making the decision that your employees will be delivery employees. Now, Grubhub and some of the others have said that they are helping with this. Unfortunately, Grubhub they came out and said, we're not going to charge restaurants. They have since kind of taken that back and said, well, we're not going to charge them until this is over, and then we're going to make our money off of them. So be careful about the delivery services. And remember, there's people on your staff that are going to need the jobs. And so if you can provide them with those jobs, those delivery jobs, that's going to be helpful too. One of the things, I don't know if I put it up here. Yeah, so be sure and get on our website if you do decide to do takeout and delivery. Things like not taking, don't require credit card signatures in order to avoid close proximity. Ensure all the food is placed in containers to avoid mixing, spilling, and leaking, and delivered to the guests in a protected manner. So get a big roll of packing tape and make sure that those things are solidly sealed before you let them out of your restaurant. Just so you know, we are sending out a survey. The tourism department has asked us to put together a website of all the restaurants and what they are doing as far as takeout, delivery. And I don't know that we'll quickly be able to put your menus up. We will probably ask for those menus, but at the very least, we will put your name on this website saying that you are open and ready for business for takeout and delivery. And then the Secretary of Tourism has promised us money to promote that website. So we're going to get that survey out tomorrow. We are planning on doing daily calls. I haven't set this up yet. If you're interested in the daily calls, please, again, sign up on our website. If you scroll down and subscribe here, you will get on our daily emails, and we'll be sending out daily emails. We'll be sending out daily calls. And so keep your eye on your emails for everything that's going on. We're going to try, there's another contact us as well, but sign up, subscribe here, and we will get you on that mailing list, and you will get everything you can from us. We're trying to stay on top of this, and it's just moving so fast that I do think the daily calls are going to be worthy for the next while. Now, you guys have some chat questions, and I will try to get to all of them. Yeah, we've got about 15 minutes. Can restaurants repackage meat, vegetables, etc., and sell so they don't expire or go bad? Yes, you can. Under normal circumstances, I don't know that you would be able to, use every precaution as far as making sure that it doesn't stay out of temperature. All of our serve-safe precautions are expected here, but I do think that we can be that alternative to grocery stores. Somebody said here breweries are making hand sanitizer, coffee shops. Oh, Antonia, let me unmute you for this one because I don't know.
Okay, so what we've seen are exactly breweries making hand sanitizer out of alcohol, coffee shops packaging the whole beans and shipping them or delivering them locally. There's been one that was interesting was this paletta bar that decided they're going to bring back the old style ice cream truck, those sort of things. I mean, I think we need to realize your clients, your customers are still there. They're just in a different place. So you have to get your products to them in their place wherever they are now, which is going to be at home or very few limited or in business. You also have to realize hospitals are not shutting down. Essential government services are not shutting down. There's lots of places that are still open and looking, how do you market, deliver to these people who, you know, are still going to enjoy a meal cooked by someone else. Something that was interesting that I saw today was a restaurant packaged kind of like the way Whole Foods does sometimes, the pizza dough, the sauce, the cheese, they packaged all that individually. And then they did a YouTube video of how do you make their pizza, you know, those sort of things. So people would come buy the packaged meal, take it home and cook it with their YouTube videos. So there's lots of ways to get creative. To say this isn't going to affect people and you should just, you know, be chipper through this, that's not reality. But there are some options.
There's some good creative things you can do, and I do like that. You know, I mean, let's get creative. Let's do what we can. Allison said she just heard from the I don't know which secretary this is, but he's clarifying if patrons can go can go inside a restaurant right now. He hopes to get back to me while we're still on, but we'll get that up on our website as well if we don't get that. And I'll get you back to my website in a second. From William, hopefully Congress does what they did in 2009 with the American Recovery and Reinvestment Act, included unemployment extensions to last for 99 weeks. If I recall correctly, the extensions did not impact employers' unemployment. It did impact our unemployment hugely, just so you know. We had to build that back up because we depleted our unemployment fund completely, and building it back up was very difficult for our industry. It was very expensive. If you guys remember, there were a few years there where unemployment insurance was crazy expensive. So we have a question: what if there are hours for takeout, etc., and the employee doesn't feel comfortable to work because of the virus? Then they file an unemployment claim when many of us need help. I think if your employees are uncomfortable, there's going to be a lot of employees out there available here very soon. And I hate to say that, but it's just the reality. I heard of 10 restaurants yesterday that are choosing to close rather than try to stay open in this environment. So there's going to be folks out there that are available. So does this mean we can sell our raw meat and produce to the public? I believe there is not a restriction on that right now. And again, we're trying to make the point to our government that it's really important to see us as that other place people can go get their groceries. Let me see. Webinar slides will be available, and this webinar will be available for those of you who have a login. It'll be available to you probably tomorrow. The webinar slides will be available on that web page that you saw there. I need you guys to send me suggestions for relief efforts. If you can think of something, I had somebody tell me yesterday that unemployment requires you as an employer to go back 18 months for an employee's records, and that's a burden on restaurants. And so I am going to be asking the unemployment office if they can shorten that time period to 6 months so that that's not yet another burden for you. You, Antonia, did you want to add something on landlords? Talking to your landlord, or was that before? Wait, I don't have you unmuted. Okay, go ahead.
Okay, so a few things we're working on with landlords with the economic development. Some people don't necessarily need to go get a loan, but with your landlord, there's a few things you could ask for. Ask them to abate your rent for the next 2 to 3 months and add it to the backside of your lease. Many of them will do that because Carol's right. They're not able to rent this space to anybody else. There's not a market for it right now. So it means they're going to get paid, just not right now. The other thing we're doing is we're asking the Economic Development Loan Relief Fund to include landlords as a lender. So that way, if you don't really need a loan, but this lease is really a tough spot for you, the landlord can go on your behalf to request the guaranteed payment, which means they're more likely to abate that rent for some period of time for you. So those are our works we're looking at. And then Carol, did you want me to address, Chilitos had a question about unemployment with reduced hours. Did you want me to address some of these other questions?
Yeah, that'd be great.
Okay, so can an employee claim unemployment with reduced hours? Yes. The government right now would prefer that you keep your employees employed as long as possible, but if you reduce their hours, they can absolutely go file a claim. Reduce them sooner rather than later, so that way they can get those claims going, and it'll definitely buy you some time there. There was another thought that came up, and we're working with this with some of our other businesses. If you have your takeout and you cook, meat, vegetables, whatever it is that you do, you put it in a single serve container and it's for somebody to reheat, you might qualify to take EBT benefits. So that might be another way, as if incomes dry up as a result of this, people who have the EBT would still be able to shop at your restaurant with that card if the food was cold for reheat later. So that might be something to call your local office on and see if you qualify.
And just in addition to that, the National Restaurant Association is asking that EBT be available for hot food as well. So
right.
in these times. So Carol, I went to your website, and besides the coronavirus, so let me just show you. When you go here and you learn more, you scroll down. These are all the announcements that are being made on a daily basis, and that can be of interest to you. But when you come down here to resource links, this is where the carryout and delivery guidelines is. This is where the list of what you need to know about closing your restaurant. So the business resources, these are announcements basically, and links to the Department of Health, the Department of Environment, recommendations for restaurants. See, and some of this is already, as of today, it's the recommendations are not worthy of anything anymore because it's all changed. The other thing that we're trying to do is, as questions come up, we're asking Antonia and her group to answer them. We're asking folks here if they have something. So if you have a question, we are putting them on here. We're talking about doing a Facebook site for our folks, so that you can ask questions of us and of other folks. But I just don't know right now if we have the capacity here in our office to keep up with those things. So have patience with us. We're madly trying to keep up with all of this. We do have help from the National Restaurant Association. We really appreciate what they're doing on a federal basis. And I talk to other states on a daily basis as well. So this is a question. We have a drive-through. Do we have to close the lobby completely and force customers to go through the drive-through, or can the lobby stay open for pickup? In Colorado, they specifically said you have to have a drive-through. So I don't think you have to have a drive-through, but you may have to deliver that food out the door. They may not be able to come in. I heard what the governor said. She very quickly made a remark about restaurants. She did not go into detail about what's happening in restaurants. I'm assuming that's going to be in her press release and her edict for the day. So bear with us. We'll have more on that. And again, that will be posted up here as soon as we get it. So right now, this is a story about what she said, but this doesn't have everything that she said. As soon as we get it, we will post it in here somewhere, right? This is her edict. Read it here. That will tell you whether they can go in or not. I'm not seeing anything. So again, don't forget to follow us on Facebook and Twitter, because we will be doing minute by minute updates, and that's one way you can get to that. Does anybody have anything for the good of the order? Antonia and Henrique, I just want to, I've unmuted you. Do you have anything that you'd like to say to everyone?
From, just businesses have seen this before, and really this too shall pass.
Henrique?
I just wanted to say that there's been, again, a lot of creativity. I know of a couple of restaurants that actually are doing the meal boxes, they're putting meals together from their own menu and letting people cook them in their house and stuff of that nature, so they can continue to, evolve in their business. And again, remember, if you have any serve-safe issues, if you want any refreshers, please contact, our organization, and we'll make sure that we get you as much information as you need. We're here obviously to make sure that we survive this together. So that's what it's about. Thank you.
So I do want to say we have canceled our classes. Any of you who have been in our classroom, it's pretty tight in there, and we decided that it wasn't a good idea to continue to hold classes. We are going to record the review, not in Spanish just yet, but we are going to record it in English, and we'll have that available on our website in the next couple of weeks. You can't take, we have asked the Environment Department for for relief from having to have the class, and they have allowed us to have that relief. As long as you're signed up for a class, you will be relieved from your need to take that class right now. I just want to say we're here for you. We're doing all we can, and we don't mind hearing from you. We will be having these calls on a daily basis, and it'll probably be a Zoom just like this without the webinar. And so we want to hear from you. We want to know what's going on, and we want to support you in any way we can. Really appreciate you guys. I know what you're going through. And it does break my heart. So we're here, and we'll get through this together. Thanks so much for being on, everyone.